Disclaimer: the content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on The Heavy Truth.
Hello, hello.
Hi.
Welcome back to The Heavy Truth.
How are you?
I'm great. How are you?
I'm good. Thank you.
What are we talking about today?
I believe we are going to now continue past the medications we talked about, but this still is on that same topic, right? Because we are going to talk about the down and dirty when it comes to prior authorizations and the process for the anti-obesity medications.
That sounds fun. The down and dirty.
Yeah. You know, we always like it down and dirty, right?
Absolutely. Makes it more fun.
More fun. I know that's a big... Yes, thank you for that, Mike. Yeah, there you go. I know that's always a big thing, right, when it comes to patients. We want to break that belief that people believe that us as the provider, we are the reasons why they're not getting weight loss medication. Right?
Absolutely.
Well, I don't know why I can't have that. My primary care doctor said if I came to work with you, you could get me them, right?
Absolutely.
So guess what, guys? There's no weight loss provider in the world that has some sort of magic
wand.
Yes, that can get you qualified, or they always say qualify you for these medications, right? We order them just like any other provider does. Your primary can order them. Your endocrinologist can order them. Whoever sent you to us thinking that we have the magic to get these medications can also order them, right? Now, yes, many times insurance companies will require you to work with a weight loss provider. That's correct. But that doesn't mean that they're going to give you the medications. And oftentimes, as we have talked in the past, there has to be an indication. And this time, we're only talking about the indication of obesity meds, right? That's what we're talking about, obesity medications. And there has to be an indication, meaning a diagnosis of obesity.
That's right. And every insurance company requires a prior authorization prior to getting that approval or denial for Wegovy, Saxenda, or Zepbound, which are, and the other ones, and the orals too, right? Qsymia, Contrave,
phentermine.
Yeah, which is cheap, and people can get that even if their insurance companies don't cover them. But
well, I mean, people can get any of these if the insurance company doesn't cover them. But we're talking, it goes from $6, $8, $20 to thousands of dollars,
absolutely,
right, per month, or however that looks. But so you say prior authorization. Tell me what that means.
So prior authorizations are a process that goes through the insurance company, which then, I don't know. I think some of it's auto-generated.
Some of it is auto-generated. Yes, correct.
So you can get like an automatic denial or an automatic approval.
And they ask questions, right? It's a basic. It's usually sets of questions, because I know the times before I realized that the organization we work for has a prior authorization team. I was trying to do prior authorizations myself, and which I still can, and many places still do. But when you go on the insurance company's website, right, or
well,
the website, there's a major website. That's what I should say. When you go on the major website, and I'm going to throw it out the one that I've gone on is it's called Cover My Meds.
It's the only one I know.
Cover My Meds, and you type in the patient identifiers and things like that, and the prescription and yada yada. It allows you to. It asks questions, right? Like, what is this being identified for? Obesity, chronic, and then it asks you list chronic diseases or all of these things. You follow the questions, and then you submit it, and then it goes to the insurance company, the benefits area, the pharmaceutical benefits part of the insurance, and then it's a determination from there, right? That's it. They make that determination factor. They look into the policy. They look into what the places that you work at, the policy, what they've included in their healthcare benefits, kind of thing.
Right. And your employer,
yes,
is the one who dictates whether or not in these obesity medications, anti-obesity medications are going to be covered. So it's not necessarily, I have Blue Cross Blue Shield, I have great insurance, they'll be covered. Well, that doesn't matter. It all matters if your employer has opted in, which is a good term. They've opted in to anti-obesity or weight loss medication coverage.
Yeah. So back in that, so the people that I've talked to about this that do prior authorizations like that, she always tells me this. Back in the day, and by the day I mean like 50s, 60s, 70s, employers got to opt out of. Why am I drawing a blank?
Meds?
Certain meds, but like is something you would take to. Why am I drawing a blank? I don't often
do
do
candy?
this. Yeah, I do.
Pick me up some coffee?
Yeah, I do. Oh, yeah. Have someone pick me up an iced coffee, please. Absolutely. Could opt out of meds, and basically things that would. Amy, help me. You want to get pregnant? You take a pill, so you don't get pregnant.
Birth control?
Birth control.
Oh,
I don't know
okay.
why am I drawing a blank? Thank you. Maybe because I don't need to take a pill for birth control. But
you had to help me out a little bit.
Employers could opt out of birth control medications as part of their plan.
Okay.
And so they had to pay it separately. And now, of course, there isn't that option. You can't opt out of birth control. But
I didn't know that.
Yes, but obesity medications and obesity and surgery. Bariatric surgery are options now that you can opt in or opt out of.
Right.
And so here's a little example. I know a husband and wife who they both have separate insurances, and it's funny that you say that. They both have Blue Cross Blue Shield, and I remember the wife telling me she got Wegovy and she was all excited, and the husband was like, "Oh, I want Wegovy too." And he got denied. And then he asked me why. And it's because his employer opted out of weight loss medications and hers did not. So he could not get that.
So, and with these individuals, they don't have secondary coverage for each other or one. No, they're each their own.
They're each their own.
Right. So, that's something good to know because patients, again, like I said, I have great coverage. It covers everything. I have Blue Cross Blue Shield, but it doesn't matter. I have, United Healthcare. I have this. It all comes down to what your employer has decided that they're going to cover and not cover.
Right. And then that I think falls back to that thing of people don't recognize obesity as a chronic disease. So they're given the option to opt out of a medication, right? Because these medications, like we had said, can be very expensive. Some of the injectable medications start at $1,000 and go up to $1,200, $1,400, $1,800 out of pocket, if not covered by insurance. And even with their savings card, they can still be very pricey and still come to roughly $500, $550. And that's with their savings card, right?
Right. And, the sad reality is that really, we have only about 30 to 40% of insurance companies will offer anti-obesity coverage, but really only a little over 2% of patients with insurance coverage actually receive the prescription. So why is that? Is that because, it's their prior auth isn't being processed correctly? Is it because they're just not seeking that medication? Is availability, right?
Yeah,
we know that's an issue too.
Yeah. Cost.
Yeah. Yeah. And there's a lot of places that I see now that are charging for prior authorizations because they're so time consuming. And it is, ours, like you said, thankfully we have a prior auth team. But at the same time, patients are waiting 2 to 3 weeks to get that yay or nay that it's going to be covered or not. And yes, it's frustrating, but at the same time, I couldn't do it. There's no way that me personally or even my team could designate that much time to do the prior authorization process, because it's very time consuming, and I don't think patients understand how much time it takes and manpower. Because I think our organization, do you know how many people are working within that department?
Yes, well over 20 people at least. And so they're covering the entire organization, not just like me or you or whatever, right? And they're not just covering anti-obesity medications. They're covering everything that needs a prior authorization, right? So it is a long, timely process, and I think that's often another thing, you said about things being a hassle. I think oftentimes healthcare providers, primary offices, things like that, they don't want to have that discussion with patients because there's that discomfort about bringing up obesity with patients, right? I had learned while I was in school, and I've heard this say, that obesity is the number one disease that providers refrain from discussing with patients because it's the hardest topic to discuss with someone, to say, hey, you're overweight, or, what are we going to do about this? Or, they don't want to bring that up.
Yeah, I could see that. And, there's more talk about, and I think there's even currently, primary gets dinged, from insurance companies if something isn't mentioned about, and they don't chart on something about weight, or if they're diabetic, they have to make sure they document on they've had their eye exam, they've had their foot exam. Yeah. Same type of thing. I know there's some insurance companies that are docking people for not mentioning them being overweight,
Oh, for sure.
So it's coming for sure, but it is something that is avoided in topics of visits often, which is unfortunate because you're really doing a disservice to your patient.
And I think documentation by the provider is key, right? Because as you had said, many of these insurance companies ask for our notes, right?
Yes.
As part of the
lot of them.
The reasoning why we want obesity medications, right? Which I always think in my mind, that's BS. Did you ask cardiology why I was going on a blood pressure medication? No, they can see that there was an elevated blood pressure. Hello, look at the BMI. Of course, I'm a professional. I am certified in this and what I do, and these are the reasons why I need it. But of course, documentation is always key. And so I always make sure, in my documentation, we say what they're doing.
How long they've done it for.
How long they've done it. The discussions they've had in the past. What if other medications they've been on? What medications they've been on? How was that a failure or a success? All of these things that they're doing, exercise-wise and all this, because all of that helps us if their insurance covers anti-obesity medication. The biggest thing is that some patients don't realize that it's a plan exclusion, that their employer has opted out. And when they'll call the insurance company and they'll say these medications not by name oftentimes. And I always tell them, please be very upfront when you call there and specific, and say, what anti-obesity medications do you cover that require a diagnosis of obesity, not diabetes, right? We're not talking about Ozempic or any of those other ones. We're talking about Wegovy, Saxenda, and Zepbound. And of course, the insurance company will say, oh, we cover tirzepatide with a prior authorization. So then they come and tell me that. And I'm like, okay, did you say, no, that's what they said. And I put it in, and it's a denial because, they do cover tirzepatide, but they meant Mounjaro, not Zepbound. And that required a diabetic type 2 diagnosis, right? So it's those things. And then it'll come back, plan exclusion. And I show them that, and like, well, that's what it is. And I said, well, yeah, but this is what they meant for that.
Right.
Yeah,
so it's confusing for the patients,
But also remember, when you're calling those insurance companies, you're usually not talking to a healthcare provider, right?
Right. No, they're just following like an algorithm or prompts or something like that for sure. So they may not know, the patient may not know specifically what they're supposed to be asking, or who knows? I mean, But each of these medications have their own set of requirements that are prior to being approved. And I've had some companies that, oh, sure, Zepbound, BMI of, 30 or above. Sure, here you go. No problem. $25.
Yeah.
And then I've had other ones that, well, have they tried Saxenda, Wegovy first? Do they still have a BMI over 30, 35?
Mm-hmm. What comorbidities do they have?
That's what they're asking.
Yeah. Mm-hmm.
Yeah. So, and even some of the comorbidities, let's say fatty liver disease, sleep apnea, high blood pressure, high cholesterol, sometimes those don't even matter. Like they want specific ones, like insulin resistance sometimes doesn't count. Mm-hmm. Prediabetes doesn't count. It's like, what? What are you going to wait until they get to be diabetic?
Yeah.
So it's as frustrating as it is for patients to not receive the medications. It's frustrated for us because we can't treat the way we want to.
Right, exactly. They're tying our hands to treat our patients, to give them the access to the medications that not only do we feel are necessary, but will help something that is a chronic disease to help that patient's health overall. Right? Mm-hmm. Not just to lose weight, right? Because we found that, like we've said in the past, these medications help with other things, right? They help with not only looking at all these, not getting diabetes, not, bringing lipid things down and all of that, those are, and with obesity being a psychological component as well, right? I mean, all of that is all tied together.
So is there any way that patients... Is there anything they can do to themselves determine if anything's covered, or if they can talk to their employer? Do you ever have your patients do anything like that?
Like we had said, the first is to contact your insurance provider and be very direct and ask for things by name. Wegovy, Saxenda, Zepbound. Mm-hmm. Does it require an obesity diagnosis? What do you require?
Is there step therapy required?
Is there a step therapy required? By step therapy, we mean, do you have to have tried, an oral medication for obesity, followed by Saxenda or Wegovy before you could be on Zepbound, right? Mm-hmm. Because some do require all of these step things. Mm-hmm. And for certain periods of time, I know I've come across insurance that will say, has a patient tried 2 oral anti-obesity medications for at least 3 months at a time and failed, meaning they didn't lose weight. And now they've had to have tried all doses of Saxenda and all doses of Wegovy for a minimum of 7 months each, because they feel like that's their step therapies up till you get to their what they call their therapeutic doses, and still have a BMI of 30 or greater with comorbidities, and now they can have Zepbound.
It's so frustrating. Yeah. I mean, again, they are just dictating how we practice medicine.
Oh, and by the way, once you get these medications, if you were lucky enough to get a prior authorization, the insurance company's expectation, and I tell people, it's not our expectation, it's the insurance company's expectation. Your prior authorization has gone through today for the next 6 months till you need another prior authorization. And in that 6-month time frame, they expect, the insurance company, a 5% weight loss. And if it's not a documented 5% weight loss, 6 months from now, when the time comes for us to prior authorize the medication is stopped until you get to that 5% weight loss. And now I have to appeal saying why I can give you this medication again and what you're going to do different to be successful than you were from the last time with this medication, because they're looking at it as this. I've given you this $1,200, $1,300, $1,500 medication for $25, but you've done nothing with it. No, that's not true. You have, but
I can't say that I'm opposed to that.
No, I agree. I'm just saying
there
is that expectation that I want to let listeners know up front, and even my own patients, is that that's a realistic time frame. A 5% weight loss is expected.
For sure. I think what annoys me more is that the insurance companies put that on, they're dictating that. Yeah. I would expect my patients in 5 or 6 months to lose 5 or so %. So I typically say, listen, statistically, our averages are much higher than that, but I'm just letting you know this is what they're going to require. And, usually I would say for the most part, people are doing much better than that. But again, for the ones who aren't, they're not ready. They're not ready to be on this journey anyway, because you should be losing. I mean, people can lose 5% just doing lifestyle.
Oh, yeah. Yeah.
So, I mean, it's not, but what bothers me is that they're making us do it.
No, for sure. And I agree. And I would say, like you said, if you have a plan that doesn't cover these things, the next step would be to go to talk to your HR, your benefits people, right? And say, why don't you recognize obesity as a chronic disease and all of these things?
Be an advocate for yourself,
Be an advocate for yourself.
And for other coworkers.
But also remember that some of these are set by state or federal. And I know they've just changed a bit recently, and we might talk about that in the future. But for example, at one point, Medicare does not allow anti-obesity medications, period. There is nothing I can do for you. Medicare does not allow it. Now, I know recently, once people hear this, it has changed a little bit. Of course, Medicare has not put out what their exact requirements are, other than you have to have it's going to be covered by Part D of your plan. But there are some.
We're talking about Wegovy to decrease their
cardiovascular risk. But there are very set requirements I heard that are going to be coming out for those CV risk, right? Cardiovascular risk. But
it's
and that
promising.
just happened a couple days ago for us, right?
It's promising.
It's promising
because Medicare dictates what a lot of insurance companies follow. So is it going to be right away? No, but we were very happy to hear this indication for sure.
But prior to this, so last week, literally last week, Medicare covered nothing, zero.
No. Did you have any people paying out of pocket for it?
Yeah, I had some paying out of pocket for it. Absolutely. Which is very sad.
Yeah.
Yeah. And that shouldn't be, for that. And some of the state-funded Medicaids do that too. I know you said in Illinois, we
don't cover anything. Yeah. Medicaid does not cover any weight loss medications.
Now, in Wisconsin, it's different. Medicaid does cover weight loss medications, but for very specific set time frames.
There's a lot of
requirements and hoops you got to jump through. But you can get it approved if you're working with a weight loss provider and different things behind it. But so we were lucky enough in Wisconsin that is a victory that we can. And that's not new for me in Wisconsin, but yeah.
One thing I want to say is when it's denied and it's a plan exclusion, and then they say you can appeal it.
Oh, yeah, you can appeal it.
That's funny.
I can appeal it to you blue in the face. Your plan excluded it.
Right.
So you're going to get an appeal and another denial.
Right.
There's nothing I can do if it's a plan exclusion.
I know. So I giggle, and at the same time, I'm like, listen, this means nothing.
Yeah.
Okay. Like you said, we can appeal until we're blue in the face. It doesn't matter.
Yeah. Plan exclusion is exactly that. Plan exclusion.
Yes. Right.
Now go to your employer and ask, why is this a plan exclusion? Right. And I've had one patient, go to her employer, say, why is this a plan exclusion? Do you not consider obesity as a chronic disease? And now her employer is actually paying for 1 year worth of the medication.
I've had that too, one time. Yeah. But again, that's because they are being their own advocate, right?
Exactly.
And there are form letters out there. I mean, utilize, Chat GPT, to write a letter saying how your employer should cover anti-obesity medications, submit it. Maybe they'll give that to the person who's dictating or negotiating coverage for insurance companies. But be your own advocate is really, because it's not Ben or I or any other, weight loss specialist or even primary that isn't doing it for you. It's determined by your insurance.
And the pharmacies quickly, when I send out medications, the prior authorization hasn't been completed yet because it takes time. Immediately tell the patient, we're waiting on a prior authorization that your provider hasn't done.
Yes.
No, it's not that it's not done.
It's in process.
Takes more than the 15 minutes that I just sent it electronically.
Yeah, right. And there's some companies out there that are charging people $50 to $75 to $100
to get a prior authorization.
To do a prior auth. So because you need that manpower to do it. So
Absolutely.
you know what? Hang tight. You know, if it takes a couple, 2-3 weeks to get that prior authorization submitted and approved, great. In the meantime, all I ask is that you continue to work on your lifestyle changes, your improved eating, your exercise, really the bottom of the pyramid, what we want you, the base. You got to work
Build
at
that base, right?
For sure.
Maslow's hierarchy of needs. Remember that? All the food and shelter and that we learned as nursing.
Yeah, absolutely. So it's not just about nobody wanting to do it or they're not doing it right.
And just know that we are your biggest advocate for these medications, right? We want you to be able to give them to you. We want you to be able to get them. We're not trying to roadblock you from getting them. I want to help as many people as I can, right?
Absolutely.
And if I can find a way to help you, right? I mean, I've done peer-to-peer phone calls. I've done all of that. And I will tell you, in all the peer-to-peer phone calls I've done, only a very small handful have been successful. The rest have been like, nope, like you said, plan exclusion, plan exclusion, plan exclusion. I'm like, okay. But because the insurance company is saying that, sometimes I'm like, I'm going to do this and it's going to sound bad just so I have record in the chart that this has been done, or just so the patient understands it was not me, right?
Yeah, right. Because
and it's crappy that we have to be that way, I have to prove to them that it was not me. You know, because their insurance company is saying, well, we cover, Tirzepatide, Mounjaro, not Zepbound, right? So
education is key, for sure. So,
but I know you had said something. So tell me what people have brought this up to, the pharmacy benefits manager, the PBMs. What is that?
Well, I mean, that's a whole nother episode, right? But they're the ones, and I know I was kind of looking up to see because there was percentages on that as far as what PBMs are, but PBMs are pharmacy benefit managers, and they manage the prescription drug benefits. Okay. So these people negotiate with drug manufacturers to secure favorable pricing for medications and manage formularies.
Oh,
now we know formularies, they get updated typically monthly. Not every company is monthly.
Some are every 6 months.
Yes, right. So they work closely with insurance companies and the employers to design prescription drug benefits that align with their overall health insurance coverage. So these PBMs dictate a lot of what's going to get covered and what's not, and what tier is it on, and is it, tier 1, tier 2,
so we're not talking, for example, like Blue Cross Blue Shield. We're talking about their pharmacy benefits, which is like Express Scripts, Optimark, CVS, Caremark, Cigna.
Right.
Okay, that makes sense.
So it all makes it different. So really what we're saying is, what's your insurance? Not a you Blue Cross Blue Shield.
Yeah.
What is your prescription benefit coverage? Is it Express Scripts? Is it Optum? Is it, because they all have different approvals or denials.
Or what's in their formulary and what will be covered. Because I think that's all done is, it's their purchasing power, right? So that they negotiate with the drug manufacturers to get rebates and discounts and all of that. Right. And so basically, if you're not getting the right percentage of the pot back from these manufacturers, the drugs won't go into their formulary, or that's where they make you say, have you basically signed over your child to us in order for you to get this medication?
Absolutely.
If you haven't yet, well, we're not giving it to you quite yet.
Yep. It's all about the bottom line. It's a business too, but at the same time, it affects patient care.
And then the manufacturers are saying, right, that those increasing rebates paid to those PBMs, it forces them to raise the price of their products, which is why they're saying these products are $1,200, $1,400 out of pocket. That patients can't get these medications.
It's horrible.
Yeah.
It's upsetting, honestly. But, just know that we are, at least for my patients, I know for you too, Ben, we're your number one supporters and fan, and we'll do everything we can to help get the most appropriate treatment. But bottom line, it comes down to insurance and coverage.
It does.
Hopefully it'll change soon.
Yeah, I think that we talked about that a little bit, that we kind of tease about that Medicaid change. I think that's kind of like where the floodgates will start to open, right? Because I've had PA people, and I've had even the manufacturers that I've talked to have said nothing's going to change until Medicaid changes and recognizes obesity as a chronic disease and starts to allow these medications, that it'll start to change, because it's like of course, everything that comes through legislation is always built into other things, right? So until that's changed specifically where Medicaid says yes, that it's not going to change. And then we've had that little bit of trickle down, and people are just now going to hear. So that's a silver lining for us, hoping that things will get better.
Absolutely.
Yeah.
Yeah. So stay positive, folks.
Yeah. And we're trying, just letting you know, we are trying, right? But you know what? That's where those compounding pharmacies get you, right? Because they're like, oh, you can't get it here, come here. And I want to throw out there, and all of those places you see online that say, look at us, come here and do our program, and you also can have Wegovy, Saxenda, Ozempic. Read the fine print, ladies and gentlemen. On the bottom of it, it says, depending on insurance, right? You're not going to some of these programs and doing their thing, and they're sending you some Saxenda in the mail. They're not. Look at the bottom line. It says on there, pending insurance.
And they already have you hooked up with their, monthly membership you pay up front for 6 months or whatever. Yeah. No, I know.
Exactly.
Scam. If it sounds too good to be true, it is.
Absolutely. 100%.
Wow. Well, on that note, I hope you found this helpful.
Yeah, I agree, Amy.
And, stay tuned for more information on medication and coverage and everything.
Everything that we talk about, eating, changing lifestyles, our own life.
Sassing.
Yeah.
Picking on Mike. Thanks, Mike.
Thanks, Mike. So helpful. So, Mike, where can our listeners find us, or tell their friends to find us?
Go to theheavytruth.net. Follow us on Facebook, Instagram, TikTok, X. And we are broadcasting on Spotify, Apple Podcasts, YouTube, Google Podcasts, iHeartRadio, and Amazon Podcasts.
Wow.
So many options, you guys.
Options.
Pass us
so
along.
Many.
Till next time.
Till next time, guys. I'm Ben.
And I'm Amy.
And we're the
Heavy Truth.
Heavy Truth.
Healthy.
Heavy Truth. Promoting health and truth. Bye.